Institute, a learning voice in precision cancer treatment and advanced radiotherapy. Dr. Kiran D. Sekhar, founder and medical director of Kiran Infertility Center, a pioneer in reproductive medicine and infertility care. And Professor Dilip K. Prasad from UIT, the Arctic University of Norway, will be the moderating today's discussion. Ladies and gentlemen, please join me to welcome our esteemed presenters and panelists in the stage.
Thank you, Dr. Arif, for a very nice introduction. And I welcome Dr. Tanuj, Dr. Swarupa, and Dr. Kiran for coming for this panel discussion with me. We are into the AI domain, and this AI impact is going to be a big event. So our discussion point is AI for societal value. And so I will start with the first question. So the question is like, I work in the research and academia, and now research is going into the actual industry and clinical practices. How this is impacting in your field, Dr. Tanuj, in cardiology?
Thank you so much. So we've seen the advent of AI into the medical practice, and especially in cardiology. I think it has had a role ever since the start of this century. Early in 2000, we've started idealizing, identifying ECGs for early predictors of ST elevation, especially in acute MI situations, acute myocardial infarction situations. There are situations where time is very, very of paramount importance in managing the patients, and AI has gone and it will go further ahead in reducing that delay. So it's not just the intelligence which matters, but how intelligently and how swiftly we are able to identify it. And it has gone a long, long way, especially in cardiology. It has moved from a reactive specialty to a preventive specialty with the use of AI. So rather than treating myocardial infarctions and already diseased patients, I think so AI can get a paradigm shift. It can shift the treatment from treatment to prevention. So we can predict a MI. In fact, there are various beautiful protocols, AI protocols, where we are able to predict the chances of a death event that is occurring. So preventing a death, I think so this is the most wonderful innovation that we can welcome from the field of AI, especially in cardiology. And it's not just that, it's not seemingly stopping here. It is moving deeper and deeper into cardiology. So in our very, very super specialty, there's a imaging modality known as OCT, that's optical coherence tomography. And AI has actually entered that field, and we are able to exactly define the lumen. So this OCT by St. Jude's or Abbott, we are able to identify the lumen, and we are able to size our stents, we are able to size our devices, we can tailor our therapy, and this is known as something which we call as mechanistic approach to coronary syndromes. So we are able to understand the mechanism only and only because of AI, because it's giving us not just that power, it is giving us that speed. It just does not fatigue like us humans. It just continues to work. And I think so there are various other innovations also. Another beautiful thing is Penumbra. So it is a device which is computer-assisted vacuum thrombectomy. So it gives us audio-visual cues which were dependent on the operator till now. Means if I am pretty fatigued, then I'm able to miss it. But if I have a auditory stimuli, if I have a visual stimuli, and which is guided by AI, which actually dictates me, okay, stop now, okay, go ahead now. I think so these are some of the few innovations which come to my mind.
So that is wonderful. How about you, Dr. Swarupa?
Good morning, everyone. I'm so thankful for this privilege. And I think AI, I would say AI has been in oncology even before we were aware of this word AI. So AI means making things easy And for cancer, this is very, very important. So it helps, AI has helped in every aspect of cancer treatment, right from prevention. So there are AI tools which help cancer to be detected early, not only in the hospitals, even at home and even in remote places. Most important is the diagnosis, an accurate diagnosis. A cancer treatment cannot begin without a proper diagnosis. So an accurate diagnosis, that too quick. The time is very important because cancer is time dependent. The earlier, the quicker the diagnosis is made, the quicker the treatment is started, and a patient can be treated in the first or second stage itself when he has presented. Another thing which is very important, which has come up right now, is the personalization of treatment. So for example, a breast cancer patient, second stage, suppose there are 4 breast cancer patients of second stage, not everyone will have the same treatment. Every cancer patient has a treatment which is tailored to her genomics, her biology, her electronic records, and her images, pathology. So it involves a lot of things where we can personalize the treatment. The treatment delivery becomes quicker. So surgery, which would take about 7 hours, 8 hours, it can be quicker. A radiation oncology. So radiation oncology means it has to be a targeted treatment. That is, treat the cancer cells only and not the normal cells. So that can be done beautifully with the help of AI. And radiation oncology and radiology have been using AI, like I said, much before the word was coined. The toxicity and the outcome, that can also be predicted with the help of AI. So which person is more prone to toxicities, that can be predicted, and proper steps can be taken even before the treatment is started. Most importantly, the help of AI is in the patient management. The huge number of patients we see in the OPD, the long waiting queues, the long hours for getting a bed, all these things are managed very beautifully, and we can use these resources for other more productive work. Thank you.
That is a very wonderful explanation. How about you, Dr. Kiran, in the reproductive?
Yeah. In our reproductive science also, AI has come up in a very big way. Actually, earlier we used to think that it's just an innovation and one of the modern things which will come and go. But it's come here to stay actually in our field itself. And all the basic tests which we do, even AI is playing a very important role there also. Right from the time when the patient talks to us from her house also, she is actually, we can give her some AI tools to actually give her history, to track her ovulation. So right from that starting phase of the ovulation to finally putting the embryo inside the uterine cavity. So I'll just enumerate very, very shortly where it helps us. It helps us to actually tailor our ovulation induction regimes to the that particular person. So earlier we used to give the same dose to everyone, but now AI helps us depending on her hormonal status, on her age group, on the number of eggs she has, that how much a dose has to be given. So there we have become very, very precise. So instead of like generalizing the thing, we have become very precise. So naturally that will give us more eggs to actually work on, and in turn finally it will improve our pregnancy rate. Now comes the second phase where it helps us is where we take out the eggs and then start giving it to the embryologist. The embryologist will tell that how many eggs are mature. So this was his subjective assessment. Now we have an objective assessment in the form of the AI coming to help us whether these oocytes are mature or not, whether they are immature oocytes which cannot be used for the ICSI procedure. We cannot inject the sperm inside the egg if it is not a mature egg. So there it is helping us a lot, and the rate at which it tells us is also very high, like 97%. There again it tells us where the polar body is. There is one body where the reduction division has taken place in the egg, and where we have to actually inject the sperm. It tells us the very precise exact point. So there again we are a state-of-art technology where it is going to improve our results. Then finally when we come to the embryo culture, finally when we come to the next day where the pronuclei are formed, and fertilization has taken place. It tells us whether fertilization is good or not, whether two pronuclei are formed or not. So there again, lot of our work is very eased out. Then we never used to take out the embryos very quickly and at regular intervals, because that spoils the embryo quality when you are taking them out of the incubator. But now we have AI-backed tools which are called as embryoscopes, and which tell us the time-lapse imaging of the embryos. So as the embryo divides, every 10 minutes it takes the picture. So it's humanly impossible to go inside the incubator and take that picture. The embryologist will take it out only once in 2 days. But here it is doing it for us every 10 minutes. And finally, all that 5 days when we grow the embryo, it is going to give us a video of that. So many pictures, And there the AI tool in our lab itself will learn from that. Because, data is also very important. So, like whatever we imagined and did not imagine also is happening. Finally, which embryo to put inside the uterus? See, there is a big, something called as, embryos are put on the slide. And then he says, this one, madam, that one, which one should we put like? So it's again a subjective assessment. But here AI is able to give us with a correct information about these embryos, that 97% efficacy of correct saying, all look similar. So it's like a beauty pageant. Everybody is going around and, you say which one is the best among them. So finally, that also is decided by that. But I don't know how far you'll be asking those questions again, maybe. So we'll answer that.
Yeah, so that is wonderful. We are here, the one who is producing the future life, the one who is maintaining the life and preventing the life, and one who is saving people. So I come back to you, Dr. Tanuj. Like, the cardiology is very preventive, or you were saying that we are moving towards the prevention side. So in your aspect, the AI is impacting the thing. How ready AI is to do the real-time cardiac care?
Yeah, so I think, I just mentioned that we have a lot of tools in the armamentarium. If I talk about cross-specialty, since ma'am is sitting about oncology, we have echocardiography, a very basic investigation, but all said and done in the past, just around a decade back, a good echocardiogram used to take around 30 minutes, another 10 minutes for its interpretation. And welcome AI, now we are able to do it in a snap of 13 to 15 seconds. So you take an image, the AI is able to predict things, and since I was talking about cross-specialty like oncology, so cancer chemotherapy may have adverse outcomes on the heart, the LV, the left ventricle, the cardiac function gradually decreases with certain chemotherapeutics. So we used to know this earlier after the entire heart has been damaged, in simple terms. But now we have special strain analysis, we have speckle tracking analysis, which is done within seconds, and it may help us
with a healthcare professional who is sitting outside, sitting in the third-tier hospital, and it can be detected. About clinical, it can be treated, and the diagnosis. So what happens, we have seen this so much in our practice. A person who is in the remote areas has been suffering from some symptoms which could not have been detected, cannot be detected there. So again, once again, so there are platforms. So there's one platform which I am very closely connected, is the Big O Health. So they connect remote areas to hospitals, which are not only cancer, cardiology, where patients need help. So they connect them, and so that the diagnosis can be made quickly over a phone or over a video consult. And then the patient can be directed to a treatment in his own place if the facilities are available, or he can be given a date, a quicker date in a hospital, in a government hospital or a private hospital, anywhere in the cities. So I think cancer has been benefited most among many other specialities with the AI, and it is a way forward.
Yeah, that's wonderful. Democratizing of the healthcare treatment is happening in everywhere. So how about in cardiology, Dr. Tanuj, how the AI helping democratizing the treatment?
So that is absolutely important to give the best treatment to everyone, but we all know by experience that we doctors, especially in interventional cardiology, we learn by experience. And I think so AI has gone way forward in interventional cardiology in enhancing our experience. So there are certain complex procedures like percutaneous valve replacement, like left atrial appendage closure. So we don't do that routinely, but now we have AI protocols in which, like a virtual reality, we can 3D do the 3D imaging by a 3D CT scan, and before we go actually on the patient, we can simulate those with the help of AI and predict the problems. And this kind of learning, it has actually revolutionized the care in structural heart disease intervention. So what we used to do with the open heart surgery around a decade back, right now it is being done percutaneously, like transcatheter aortic valve replacement, transcatheter mitral therapies, left atrial appendage closure, and we know when not to go ahead. And one beautiful use of AI at our own hospital, so we had a very young girl with a left atrial appendage aneurysm. So it's not, I'm not taking you into the details, but I'm telling you this is one of the 200 cases in the history of mankind, which we have 238 cases, and it was one of its peculiar kinds. And with the use of virtual reality, with 3D reconstruction, we were able to predict what complications we could face even without entering the heart. And such kind of preparation, it is possible only with the advent of AI. And as you just mentioned, cardiology might be changing its shape from reactive medicine to predictive medicine, but also in the therapy part, it will really help in identifying the right patient and doing the right procedure. And it will give us experience, it will give us intelligence in a very short span of time.
So Dr. Tanuj, you mentioned correctly, like it is helping. Now, you know, AI to get integrated into the healthcare system, it has to go through the clinical trial.
Yeah.
Would you like to highlight that how currently the clinical trial and this AI-based tool is going through in cardiology domain?
Yeah. So that is where I think so the challenge lies. Means conventionally, I'm a research director at my institute also. We do have a lot of randomized controlled trials, around 14 randomized controlled trials in cardiology working. But all of them, one thing which they require is data privacy. And AI works on a cloud-based system. So we do, whenever we use AI, we all are afraid of losing our data. And in context of research, this is extremely important. And whereas AI is extremely good, I would caution to its overuse in population that the trial data does not represent. So a trial of AI which is done in US may not be applicable to a cohort in India or Pakistan or Bangladesh. That is not possible. So, but again, understanding, so we don't have to overfit, we don't have to underfit, we have to choose the right thing. And henceforth, maybe even in cardiology, it's extremely difficult to conduct a trial. Unfortunately, despite the rapid advances, even AI gets its pitfalls, and it tends to auto-correct itself, and AI works at a level where human mind cannot reach. So that is another, so that is known as the black box problem. So we are not able to connect those dots. AI is able to connect those dots. It may even force us to see something which is not true. So we have to be extremely cautious what protocol we are applying and to which subset we are applying. We are not overfitting, we are not underfitting, and henceforth RCTs, we've had RCTs, so there is something known as a state HF trial, which helped us predict heart failure before it actually happened. And I think so this is K-core device or a micro-core device. It is something beneficial, but getting it to the masses and with that kind of RCTs, so maybe AI would actually change. This is something very futuristic, but maybe over the period of time, AI would dictate that we have to change our methodology of research too.
So that is wonderful. We talk about the privacy aspect of it. When we talk privacy, then the ethical aspect comes. So Dr. Swarupa, how the ethical aspect is taking taking care in the oncology treatment where AI is getting used? What precaution we should keep?
Yeah, so this is another very important aspect along with the legal and the other things. The ethics is very important. And so the first thing we do is that when the patient comes, we are always discussing with the patients very openly. Written consent is, if we are using an AI tool, it has to be discussed with the patient which AI tool we are using and how much we are depending on it, and a written consent has to be taken with the patient. And the other thing is that how much dependent should we be on the AI tool? That also comes in the area of ethics, because the AI, like we know, they depends on the data which has been fed. So there should not be an algorithm bias. So the data should be from diverse specialities, diverse sources which has to be fed, so that the results we get, they are more true. So this is another aspect. Another is that the equality. So there should be equality in the patients who are treated with the AI tools. So many times we do not know that which are the patients who need to be prioritized. So that needs to be treated. And also not only that, it will be very surprising to know that many times AI priority is given to people staying in the higher, the more influential areas, and who are more influential. So these equalities should be minimized, equality should be maximized. And most importantly is that whenever we are using an AI data, then for everybody should be undergoing, whenever we are using it, like I said in the previous also, the human should be there. We should not be fully dependent on the AI tools, and it has to be told to the patient also that there is a human in the loop, and it is the human, it is the doctor who is the oncologist who is making the decision, and the AI is just helping it. It just helps in the accuracy, it helps in the quickness of the treatment and the diagnosis, but the control has to be with the patient, with the physician.
Yeah, so the control has to be the patient, and that is also the EU AI Act, and the data guidance is there that the human should be in a control. So now, Dr. Kiran, the AI can also be used unethically, and different kind of AI tools has to follow the ethical guideline. What is your say on that? That how the ethics is getting and compliance is getting maintained there?
Yeah, the ethics and morality and the compassion, all these things, as Dr. Swarupa said, here in my reproductive field also, it actually works. It has to be taken care of because ethically we should inform the couple that AI is going to actually select the embryo or select the oocyte or do the ICSI help to us, but finally the doctor and the embryologist will be the one who will say yes, this embryo has to put, because your role is also very, very important. You can't actually hand over all your role to the AI, and then finally you have to take consent also from the patient that AI will be actually doing this for you. But finally they would come and ask you only whether you are responsible, or the company which actually set up your AI system is responsible, or the doctor who did the embryo transfer is responsible, or the people who have set up the AI, all that paraphernalia is responsible. So that kind of legal things also come in. So we have to be very, very careful and very compassionate.
So that is wonderful said. In the audience, do you have any question for our panelist? One question we can take. Yes.
Can you give some insights about this?
Yeah, so we have especially means at every step from diagnosis to treatment, we do have protocols. AI enabled ECG monitoring can help us reduce the time to delay to cath lab. it's very important. If a person has chest pain, diagnosing that patient early, and with AI automated tools with ECG detection of ST elevation will really help. And it will also prevent unnecessary calls. So there has been a study which said that unnecessary activation of cath lab reduced from 42% to 8% by the use of AI tools. So that's ECG. Echo made it faster. You have intervention guided procedures like FFRCT. There is a protocol. You can know the significance of a stenosis by AI-enabled protocols on CT, on simple angiograms without intervening. And then in the therapeutic armamentarium, you have virtual reality protocols. You have OCT. I mentioned a protocol of OCT, that's MLD Max protocol. We can guide our stent size. We can decide what to do with the lesion, whether to treat it or not. So it is reducing, it will help us prevent the healthcare burnout also. So AI is not something we are using for luxury. It might become a part and parcel of everyday practice in the times to come.
So, Dr. Tanuj, he has one more question, please.
Yeah, absolutely. So we are working on wearables. So we call this as wearables. They come with a little bit of caution. As I said, we should try to see which kind of people will actually benefit the most. So these rings, they can help you predict heart rate. They can predict the incidence of AF in the times to come. It can predict sudden cardiac deaths. So it might not be applicable to helpful for everyone, but in a high-risk population, definitely.
So let me thank you. We have our time limit. So now we have a wonderful discussion. Now, as a closing, what is your final say, Dr. Swarupa, on where the societal impact will be there for AI in the healthcare domain?
So AI definitely is the way forward. So we have to adopt AI as quickly as possible, and for that we have to train ourselves and our colleagues in all the AI aspects so that we can use it faster and we can use it in a broader aspect.
So how about Dr. Kiran in the reproductive domain?
I totally concur with Dr. Swarupa, what she said. Actually, when the computers came in also, they said no need to do all that. We can always calculate. But here we are today. So same way, AI also is very, very important in our medical field. But what place you give it and how you actually take the help of it. So you should go hand in hand with AI, the doctors, and because AI is not going to replace the surgeon or the, whatever doctor is there, reproductive medicine doctor or any specialty doctor. So we have to work hand in hand, and then with that cumulative and synergistic thing, we can achieve more.
So the caution should be there that AI should go hand in hand. How about Dr. Tanuj?
Means in my field, cardiology, I will not let AI take the pilot seat till the time it is ready. It can at the most be a co-pilot. It can guide me a bit, but it is very, very distressing. As I was mentioning, the AI protocols, sometimes they dictate and we realize that it is wrong. So we have to be cautious about that. So AI-based learning, it is directive at times. So if it is a supervised learning, it's okay. If it is a unsupervised learning, which it is trying to extrapolate, then we have to be extremely cautious. So, but all said and done, I think so, since the healthcare system is so overarched, it's so strained, I think so if we welcome this AI, we may reduce the healthcare costs. We are not increasing the healthcare cost, we will reduce the healthcare cost. But for all doctors, we have to view that our entire strategy would change. We will not be in the conventional way of handling things. We have to move ahead. We have to take it with grace.
So that is wonderful said. We discuss on various topics like, the hand in hand it should go, and AI can democratize the healthcare to larger population. But we have to be cautious that where to be used and where not to be used. And definitely, I agree with you, Dr. Swarupa, that the doctor should not be replaced with complete autopilot AI mode. So with this, I would like to, we have a very esteemed panelist. They are the top doctors in their field. You can have a discussion with them after the session. So with this, we will end this panel discussion. Now we have another speaker for a keynote speech, Dr. Gunjan Gupta, and she will be taking over. So Dr. Arif, can you please come?
I hope that it helps us to understand the AI and impact in the society. Ladies and gentlemen, as we move towards the closing of this inaugural session, it's my great pleasure to invite our keynote speaker to the stage. We are honored to have Dr. Gunjan Gupta Govil, founder of Gunjan IVF World, a distinguished expert in reproductive medicine who has contributed significantly to advancing fertility science and patient awareness also. Please join me in warmly welcoming Dr. Gunjan Gupta Govil.
Thank you, Arif, Dr. Dilip, and Arctic University Norway for giving me a chance to come and speak on this platform where we are going to talk about navigating innovation, ethics and regulatory compliances, and AI in its role in fertility and healthcare. As I am a fertility specialist working in the field of IVF and fertility and FRCOG and FICOG. After a little about myself, before I begin, it is like that, yes, I have been working a lot with AI innovation in the field of fertility and healthcare, and that was the reason I was recently awarded with the Femina Achievers Award, besides the other things. And a little journey about myself. I came from UK in 2009 where I was practicing, and after that I started working in the field of women health. But yes, women health led to the need for motherhood and fertility, and that's how I started my chain Gunjan IVF World, which has been doing very well, and we have been giving results in that. The most important part, but of course, is how we have created an Indian impact on and our research has been coming on the global impact as well, because we have presented our research in Eshrei, Europe, in Copenhagen and Amsterdam, and again the AI-based innovation which I'm going to talk about, we recently presented at San Antonio ASRM. I have also authored the first book on egg freezing, which is the new domain which we need to talk about and we need to start working. So can I have less noise, please? It's too noisy. Can you please close the door? Thank you. Thanks. So basically the role of AI in IVF, it is very, very important. We know around 1/6 of the people are suffering for fertility. In India also we have around 25 to 30 million people who are facing this problem. So what we need to understand, fertility is a bit challenging. Why? Because no two people with similar histories will have a similar outcome. Then again, cardiac may you can predict, as Dr. Tanuj was saying, but when it comes to fertility, do embryos behave the same way? No. So that is where maybe the AI could be an important thing. And from here I speak not as a technologist but as a clinician, because I'm a person who has to answer those questions like, why did my IVF fail? Will it work this time? What changes are you doing? So that is where AI has a very, very important, I feel, in IVF and fertility. And again, IVF is a data-driven thing. We have a data rich around the hormones, the doses, the tests, the investigations, the imaging, the lab parameters, the embryo development, the clinical history. So, and historically, we have been depending upon human interpretation and experience. This is the time, by including AI, we will reduce the subjectivity and bring consistency in complex decision, and this is where we have to work. Now we come to patient-centric AI, what we can do. At Gunjan IVF, we have recently developed an AI-based fertility meter, which is based on BMI, the physical parameters like the BMI, the age, and other things. But besides that, we have also included social parameters, the lifestyle changes, and that will give us an outcome as to her chances of her natural fertility, her chances of IVF success, and how to help in her IVF journey. And it has been developed for single males, females, and couples. The advantage is that it gives the couples a clearer vision, a clear answer, and also reduces emotional and financial burden. So this is how our fertility meter looks like. This is the different tracks we are doing, and this is the biological, the environmental, and the socio-economic things I was talking about. So this was about the fertility meter. The other thing which we have innovated is AI-driven personalization of the human menopausal gonadotrophin dosage. It's such a beautiful thing because it's a smart way to develop the dose which we need to stimulate. Then it is data-driven, and based on AI machine learning, we have moved on from one size fits all. It has a high accuracy, which we've seen around 90%. So it is more cost efficient. It brings safety first. We prevent an overstimulation and accessible care. This is the thing which we have presented at ASRM San Antonio in last year in 2025, and that is where it personalizes the profile and also includes if the lady has gone under previous stimulation and gives us an outcome. So this is how it looks like on the UI UX interface, and I will just show you a small video as to how it works. So here we are filling in all the data. So we have put the age, the AMH, the height, the weight, and the count, and then we just have to click. So a click of button, it will give us the HMG dosing strategy. What is the stimulation? So we got a stimulation, the dose for 9 days, and the dose is required. So this is the beauty of it, because that will reduce the burden on the doctor. It will make it much more easier, because now my nurse can calculate the dose. In fact, my EA can calculate the dose, because all she needs to do is fit in things and we get an answer for that. Of course, it doesn't rule out the role of doctor, but it makes things easier. So this was two indigenous things which Gunjan IVF has developed, and now talking about where we are using AI. Most important is semen analysis. It is a test which has been done over the years, but has been manually dependent. But what is an AI-based system? It is so beautifully that it assesses motility, it assesses morphology, and then it generates a video-backed report. I will again play the video if you can see. This is the blue sperms, which is the actively motile sperms, and it is reproducible. It can also be checked again and again. So it is a meaningful upgrade if we talk about these things. Then, of course, as Dr. Kiran has already talked about it, it is the embryo selection. Yes, we have AI-based embryo selecting tools which are available, which help us. You can say they are a guidance. They are not an absolute end to things, but yes, they do help us to guide as to which embryo would give a better outcome. It is data driven. It is based on multiple feeds which it has gone. And of course, it is, you can say, used as an adjunct to an embryologist. So this is the major things which I tried to cover, because 10 minutes is a very short time. And now where India stands today, of course, we are at an inflection point today. It is a time things are going to change. We have no doubts about it. India, how does it have an advantage? Why? Because we have large and diverse populations. We have lot of data. We have cost-efficient IVF delivery, highly skilled clinicians and embryologists, and rapid digitalization of healthcare. Our challenges, of course, is the fragmented clinical data, limited large-scale validation studies on Indian patients, because most of the data is Western-backed, and uneven access beyond the metro cities. So we are in a time when India is adopting AI, but we need to start shaping it. And beyond this, where AI would go further, I feel it will be helpful also in predicting what is going to be the miscarriage rate, what are the chance of a healthy baby we will be delivering in when it comes to AI and fertility, cycle to cycle optimization, and of course, most important, democratizing IVF. That is, the quality should be better. We should be using AI, as I showed you my calculator, in smaller clinics, tier 2, tier 3 cities, and young embryologists. And of course, combining AI with genetics would help us in predicting, reducing the failed cycles, lowering miscarriage rates, and focus on healthy outcomes. So this was about it, and it is the time to understand, but AI cannot replace clinical judgment, experience, empathy, and trust between the doctor and the patient. Fertility care, of course, is deeply human, and we have to act responsibly. But there is an opportunity, of course, for India to build fertility AI data sets and develop AI solutions which are also affordable for global use. These platforms which I have developed is with help of my daughter Samriddhi, who is just currently a student of Kellogg but otherwise an engineer. So she put in the efforts to do all the coding, which of course as doctor I cannot do. So this is just a final look at one of my centers, how we love to work and do things. With that, I bring my talk to end with just one note that success in creating AI would be biggest event maybe in human history, but it can also become the last event if we don't use it judiciously. Thank you.
Thank you, audience. Thank you, everyone, for being here and taking part in this session. With this, I announce the closure of this session. We will have more session coming, so you can be seated for other session, or you can find another session to other places. Thank you very much. See you again.